Hi, everyone. My name is James Geri, and I'm a clinician at Nugent Family Therapy in San Jose, California. We're more than a year into the pandemic, and people have already become accustomed to the lives they've built and the routines they've created in their COVID caves. It seems natural to be anxious about returning to interactions as we once knew it to be. According to a survey by the Centers for Disease Control and the Prevention's Morbidity and Mortality Weekly Report, the pandemic has taken a mental toll on Americans. As of June 2020, nearly 41% of adults in the US had reported that they were struggling with mental health or substance use, with 31% reporting symptoms of anxiety or depression, and 26% reporting trauma or a stressor related disorder directly related to the pandemic. Specifically, staying at home and at a safe distance from others may have kept us physically well, but in some cases led to greater isolation and loneliness, which is always linked to poor mental health outcomes. Now that we're gradually able to resume activities, outdoors and gatherings with friends and loved ones, how are we supposed to behave socially? What are the rules? Today, we'll be speaking with Dr. Geoff Nugent from the Nugent Family Counseling Center about how to reconnect with others after the pandemic. Welcome, Dr. Nugent.
Thanks, James. Appreciate it.
Okay, so why does social interaction feel so weird and awkward now?
So think about this whole pandemic experience, right? We went from being social beings, social interactions, to this whole experience of what they classify as social distancing, right? Social distancing means you're not allowed to be within 6 feet of somebody, or you're not in some places even allowed to be in another household with anyone else that doesn't belong to your household. So think about all the social interactions that we have on a regular basis. There's so many array of complex aspects that come into this that allow us to then start to think about, how do I now, as this pandemic is ending, and I was so comfortable sitting in my home doing Zoom meetings, Zoom conferences, how do I now interact with people in real life? What does that mean? Do I still maintain my 6 feet distance? Do I wear a mask? Do I go without one? Right? We're thinking about all these different aspects that are involved. Think about, we have thoughts of speech, language acquisition, interpretation of body language. We have all these things that are going on at a constant rate, and awareness that we're not used to, especially since we've had a year off of it. It's going to be awkward. It's going to be one of those things that's going to take a little bit of time for people to start to get, as we're starting to say, the new norm, which one, I don't like the new norm. I think normalizing it again is more of what's kind of the appropriate term for us. We want to get back to the normal of what life is. And that means social interactions. That means being in life with people.
So, is it possible to make the process of reconnecting less painful? And if so, how?
Well, yes, it is. Part of it is going back to the normal, right? Figuring out what normal looks like. We've all gotten so used to this whole aspect of being at home, Zoom meetings. There's a lot of comedy jokes on, on national TV now, or even commercials where they're showing individuals coming out in their underwear when it's a real life, connection, versus thinking that it was a Zoom meeting versus an in-person meeting. So we're seeing all of this different stuff coming out. They're trying to ease us back into what life should be like, actually having those personal connections, right? It's about identifying what the rules are, our new rules that we're trying to engage in. And how do we want to gain that footing around what this life, this normal now looks like? And it's going to be different. I was reading in an article recently about what they call the extreme maskers, right? These individuals that, even though they're vaccinated, they're going to still wear their masks. Well, how is that going to be for somebody who doesn't want to wear a mask? How is that going to be going into a store when you see the mix of people? How do you interact with them? How do you find this new rule of social engagement that we're really looking for? There's also a couple of things that we got to think about when we're looking at this is, what is our basic rules for us? How do we find and identify what's comfortable for us, right? We have to know that there are things that we can say no to and not feel guilty about. We have to know that we need to feel and treat others as well as ourselves with respect. We want to make others feel important just as much as we would like them to make us feel important. And we have the right to accept that there are going to be mistakes in our process of moving forward, of coming out of this pandemic, that this process, this newness, is something that doesn't have to be perfect, right? Listening to your gut can help you. Some of it is telling you that you're uncomfortable, and that's okay to recognize that you're uncomfortable in these new situations. It's helping you identify that you can actually start to move forward, that we can actually have these new experiences of being connected with somebody without this screen in front of us, right? This is what we used to do. This is going back to the normal of what life is. And lastly, we should be able to know that we don't have to meet unreasonable expectations of others. We should be able to have those firm awareness that for ourselves, what these things are and what we're okay doing versus not doing. Like I said, those that want to keep their masks on, if that's where they're at, great, that's where they're at. Those that are fully vaccinated and following the CDC guidelines as they're currently stated and want to take their masks off and are allowed to, awesome. But it's also identifying where it fits for you as an individual and how in a group setting that is going to match. Because as human beings, we're solely engaged in understanding what's going on with the person by watching facial expressions, tone of voice, volume control, body language, proximity. This whole aspect of being 6 feet apart was really hard for a lot of people. And then when you come into the concept of having to do the Zoom burnout and everything that goes on there, our social engagement, our social awareness has gone from maybe up here down to about here. And it's going to take some time to climb back up. And that's okay.
I imagine it probably taken a fair amount of resilience to do that. And that kind of leads me to my next question. How does human resilience play into our ability to reestablish relationships post-pandemic?
So human resilience is huge. This is going to be one of those things that when you think about how human resilience continues to move forward, think about in 1911, the Spanish flu, right? That took over. And at the time that there was the scientific community and their ability to create and use vaccinations, it wasn't there. But human resilience, human ingenuity, the fortitude there allowed us to get through that. Now, think about all the advancements that we have, right? We are a resilient race. We find problems that come up for us, and we figure out as a race, as a group, how to overcome those, right? How to really build this perspective of what can allow us to move forward. Inventions. Everything we have today came because of the human resilience, because of the ability to move and push through the troubles that we were facing in the times, right? It allowed us to get to this space of having these psychosocial awarenesses that we currently have today. How do we have the social IQ to be able to engage with somebody, along with IQ, to be able to create these experiences to allow us to move forward? I love technology. I think technology is an amazing thing. It allowed us to get through this pandemic with still connecting with people, still carrying forward with the ingenuity of life, right? But at the same time, I think technology has a time and a place. I think being able to get in and being with people again, having those connections, allowing our brains to utilize the mass capacity that we have there to really connect with somebody and really make somebody else feel like they're part of our experience and we're part of theirs. That's connectedness. That's the resilience that we're looking for. That's what's going to allow us to, one, get through this, but anything else that's going to come into our lives, anything else that we're going to face. And it's not that people won't have trials. It's not that they won't have depression or anxiety or some of these other things that come up. That's not what resilience means. What resilience means is that even though those problems exist, we will be able to continue to move forward and get through them over time.
Well, thank you very much, Dr. Nugent. Certainly acknowledging our need for connectedness while understanding that it may take some time for us to get used to being with others again may help us relax and be a little bit more intentional about who we interact with post-pandemic.
Oh, exactly. When we think about this post-pandemic experience, it's about reestablishing our healthy routines, right? The things that we wanted to do or that we were doing before this happened. It's about creating those appropriate boundaries and identifying how those boundaries fit with who we are. Not allowing people to just breach our boundaries because now we're allowed to socially engage again, right? It's about listening to and validating one another. See, I think the whole experience of this pandemic and everything that's gone on has created where a lot of people don't hear others. They don't validate what they're hearing. Now, I'm not saying you have to agree, but they don't validate. They don't have that human connection like we used to when we were face to face. It creates a whole different concept in the brain that allows us to actually feel like we're there with them. And you don't quite get that in the Zoom experience, but the fact that we're now moving out of the pandemic allows us to have it, which is awesome. And it's about spending time with one another, learning through time what this is going to look like and how to navigate it so that we can connect and feel comfortable in doing it.
Well, thank you very much, Dr. Nugent. This has been certainly very enlightening. And for everybody else, any additional information about this topic and more, please visit NugentTherapy.com. That's NugentTherapy, all one word, .com. Thank you very much, Dr. Nugent.
Thanks, James.